Hello, my name is Ronnie Jo Scarlett, and I'm a physical therapist with Schneck Medical Center. I work in home health, and today I'm going to be talking to you about falls, reasons people might fall, and then we'll go into strategies of how to prevent falls, and eventually we will even go through exercises for lower extremity strengthening and balance for fall prevention. Falls are the number one cause of injury for people over the age of 65. Number one cause of injury. Now there's people are sick for other reasons, but they're talking about injury, broken bones, broken hips, that sort of thing. 1 in 3 people over the age of 65 will fall each and every year. 1 in 3. Now for those folks who are over the age of 80, the incidence increases to 1 in 2. That's half of the folks over 80 will fall every year. Of those who fall, are 1 in 3 or are every other person over 80, of those who fall, only 1 in 40 will be hospitalized or seek medical treatment or help of some sort. Of those who do fall and go to the emergency room, the hospital, the doctor, that sort of thing, of those who fall and go to the hospital, only half of those folks will be alive 1 year later after their fall. It's kind of some scary statistics when you think about it. But most falls we know occur within the first 14 days of starting a new medication or changing any medication. Certain things we know about those people who fall, they're over 65 years of age. A lot of them have some form of mental impairment or confusion. Most of them are female. Most people who fall have a history of prior falls. They were in that group of 1 in 40. They were the 39 who didn't get hurt the first time they fell. Those who fall also usually have weakness of their legs or their feet. They have trouble walking, such as shuffling, or they're using a walker, a cane, some sort of assistive device, and they have foot disorders, such as numbness in their feet. More risk factors include vision problems, those who can't see the floor properly, or steps. Those folks who have balance disorders are also more likely to fall. We also know those who fall have a low vitamin D count, and if you have a low vitamin D, that's typically associated with osteoporosis. If you have osteoporosis, sometimes you actually will break a hip before you fall. We also know of those who fall, they recently, within that past 14 days, have had medication changes. Some of those people who fall complain of arthritis. They have pain of walking. And a lot of people who fall have a diagnosis of Parkinson's disease. What is a fall? A fall is any unintentional change in position resulting in coming to rest on the ground or at a lower level. A lot of people fall but don't fall to the ground. Maybe they catch themselves on the couch or a chair. Other falls are completely to the ground or the floor. So a fall is any unintentional change in position where you come to rest at a lower level. So how can you prevent a fall? 4 categories. You want to make your home safe. We'll also talk about having your vision checked. The third thing would be reviewing your meds with your doctor and watching when you make changes with your meds, and exercising regularly, building up leg strength. Prevention idea number 1, of course, is the home safety. Making your environment, your home safe for the prevention of falls. First thing you can think about or adjust is having proper lighting in your hallways, your bathrooms, all of your house for that matter. But we need to talk a little bit about having night lights in the hallways, in the bathrooms, especially at night. Another idea for your home safety is to remove all clutter from the walkways and especially stairs. The floors should be clear of boxes, of trash, laundry, anything on the floor should be removed. You should have a very wide open walking space. And that includes moving excess furniture such as coffee tables. You don't need a coffee table if you're trying to walk with a walker and get over to the couch. It'll just get in your way. You might trip on it. You can remove any extra large pieces of furniture that you don't sit on that are interfering with pathways, doorways. Make your home open and clear. You need to remove all cords, such as the telephone cords, electric cords, anything that might be on the floor should be completely removed. Don't tape them down. Don't put a rug over them. Remove them. Your flooring should be in good repair. All edges of linoleum, carpet, tile, everything should be firmly attached, secured, nothing loose, nothing frayed, nothing cracked. You need to install, or we recommend installing grab bars in the bathroom, around the toilet, and around the bathtub. You can also install grab bars on your stairs up and down to the basement, up and down to upstairs, or the stairs in and out of your garage or your house. Recommend installing some type of non-skid padding in your shower or your bathtub so you don't slide and fall in the tub, and recommend that you wear proper, well-fitting shoes. That's not flip-flops, that's not big old floppy house shoes. Keeping items in easy-to-reach locations, such as in your kitchen cabinets or on the countertops. We don't want you to do any climbing or reaching where you can't reach. Another idea would be to wear proper fitted clothing. Don't want you wearing loose, baggy pants that are dragging the floor, or long robes, long pajamas that drag the floor. You can trip on those items. Your sidewalks outside your home should be in good repair. No cracks, no loose pebbles, concrete, that sort of thing. They should be in good repair. Another home safety item is to beware of pets. You can trip on a pet. A pet can actually jump on you and make you lose your balance. So pets are a danger. Another home safety idea is to be very careful while carrying your packages. If you have limited strength and carrying your groceries in the home are difficult, you can revamp with some sort of a cart, like even having a shopping cart at home to move your packages. And be sure to not overstretch, overreach, picking things up off the floor, in the bathroom, picking up towels off the floor, that sort of thing.